Do we have a special guest on today? Tamara Higgs,
Good
right?
morning.
Good
Yes.
morning. How
Good
are
morning.
you?
I'm well.
Good. You know, I love having Eric on, but you're definitely way better to look at.
Oh, we
No
love
off-
Eric.
No offense, Eric.
We love Eric.
Yeah. So, brought you on because you do something amazing. You do amazing work.
I gotcha.
Yeah, thanks. Can you tell everyone what you do?
I am a certified orofacial myologist. Nobody knows what that is.
What is that?
Orofacial myology. Orofacial just around the face area, and myology is the study of muscle function. So, because muscles move bones, and we are integrative beings, so depending on how that happens, it affects us tongue to toes.
Okay, tongue to toes. Can you explain that a little bit more?
Let's see here. We would have to kind of back up.
Let's
right?
back up.
Let's back up.
Let's back it up.
Back it up. Way back in utero, 15 to 17 weeks in utero, there's tongue forms, 8 muscles on the left that are also paired, come together on the right. About 15 to 17 weeks in utero, and then the string in the middle recedes back to the posterior third of the tongue, and the tongue starts this kind of peristalsis-like motion. And because muscles move bones, it's that peristalsis motion of the tongue 1,500 times a day that applies pressure to the developing jaw bones, and then that is how our mouth is then developed. And the roof of our mouth is connected to our facial bones, which is literally connected to our cranium. So the tongue is the CEO of that developmental growth. And then even more so than that, depending on how the jaws develop, is how our airway develops. And that kind of bridges a lot of your field and my field. It is really tongue function and breathing and airway and that kind of stuff.
So why is tongue function and breathing important?
Well, essentially, the two main components of it are, number one, depending on how the tongue functions, where it rests throughout the day, as well as the 1,500 times a day that we swallow, determines the growth of the jaws, the size of the airways, how we breathe. When I say the word airway, a really good visual would be to think of like a garden hose. So like each nostril is half of the garden hose, and then that garden hose goes over the roof of the mouth, down through the throat, and into the lungs. And we need a big garden hose size airway. Obviously, if I handed you a straw, per se, and it was the size of a garden hose, and I said, breathe out of it throughout the day, you could do it. It'd be, annoying, cumbersome, but you could do it. Now, if I exchanged that big garden hose size straw out for something a lot smaller, say like a Chick-fil-A straw or even worse, a coffee straw. I'm aging myself here when I say coffee straw. But nonetheless, you can see that it'd be taxing. You perhaps wouldn't be able to complete the same tasks that you would throughout the day. Your nervous system would be pretty stressed out. And so tongue function develops the jaws, develops the airway so that we have an adequate sized airway to breathe. And then secondarily, so that's probably the first main component of tongue function. Secondarily, our tongue connects us all the way to our toes. Most people don't realize that. But we think of how we are, our skeleton, our bones, and what moves bones, muscles. But what moves muscles is connective tissue and fascia. And so I really like to talk about fascia is like the glue that holds us all together. A really good analogy is like an orange, the white part of the orange, if you will. So the pith. So you have this orange, and the white part holds the whole orange together. That's the fascia in our body. It's the glue that holds us together. But just like in that orange, there's a large white piece down the middle. And wherever that big white piece in the middle goes is where like the pith around the segments go. And so we have that in our body. It's called our deep front line. It starts at our tongue and it goes all the way to our toes. So it's this very big, deep, solid one piece of fascia from our tongue to our toes. And our tongue is like the rudder on that ship. So wherever the tongue moves, not only during mastication, during chewing, but again, the 1,500 times a day that we swallow on average, is where that entire deep front line of fascia goes. And wherever that fascia goes is where our muscles go, and wherever our muscles go is where our bone goes. So really, the tongue is the director of our skeletal alignment as well, or misalignment.
Mm-hmm.
So 2 main components of the tongue.
Wow.
Who knew? I certainly didn't know. And I was in mouths for 17 years before I'd ever even heard of this.
Okay, so let's talk about that. What were you doing before this?
I still am, but I don't practice, just a registered dental hygienist. I was working in mouths for many, many years. Like to think you are doing some good. But truly, I was never taught the whys or the hows. How does the mouth grow or lack thereof? Why do some people have crowded teeth and some don't? What the tongue has anything to do with that? The airway. I wasn't taught any of that, and it wasn't just me. That's not how our Western medicine world works. It's not exactly getting to the functional components of it and how it all develops. And so I was seeing a lot of things going on and not really knowing why. And that's not who I am as a person. I always want to get to kind of the organic root cause. So you start learning about why, and then you learn that it all goes back to tongue function or lack thereof, which occurs like 15 to 17 weeks in utero is when it starts. So yeah, I started learning about the hows and the whys, and there was no turning back after that. A lot of what they're in the dental field treating are the downstream effects of it. Perhaps a person grinds their teeth. Well, we'll just put in a mouth guard and that's a Band-Aid. Mm-hmm. Teeth are crowded and crooked. Well, teeth are symptoms of the jaws. So if the jaws are underdeveloped, which also means the airway is underdeveloped, which changes our entire nervous system, then the teeth have no room to grow in a straight manner. But we're putting kids in braces, right, to move teeth around, in completely ignoring the foundation, the bones, the jaws, the airway. So we're treating a lot of the downstream effects associated with it, and not the developmental, functional, integrative part of it.
Wow. I mean, that's huge, because if you think about how many kids need braces, right, have crooked teeth. Mm-hmm. I mean, so you're basically saying that, like, I don't know, 95% of humans have underdeveloped tongues and jaws.
Correct. Yeah. Now, right?
Wow.
Yeah. Most people are just, that's just how we grew, right? Like, everybody needs braces. It's kind of like a rite of passage or puberty these days. But it's a symptom of underdeveloped jaws and airways that have much bigger systemic health implications.
Why do you think that is? Why do you think so many people are born like this?
Yeah, I mean, the major component is that we have a very westernized diet now. We're not hunters and gatherers anymore. Right? Our food it's cooked, it's processed. We're giving our children, pouches of applesauce instead of a whole apple. Everything is very, very processed, which means that there's less mastication, less chewing, right? You see the mastication involved in chewing a whole apple, mm-hmm, versus just squeezing a pouch and it goes down the throat, right? The ease of it, but there's problems associated with it. So essentially today we are chewing about 1/3 that we used to chew just 200 years ago, 100 years ago. In that lack of chewing, that lack of mastication, less tongue function means we're not growing our jaws as much, and then we're not growing our airways as much. Our entire skeleton, so our sinuses, the opening of our nerves to operate our eyes, our nose, our spine, our digestion, everything is very underdeveloped because we have a very westernized diet now.
That's crazy. That's crazy. So basically all these food substitutes are causing the problem potentially, right?
That's one of the main components. Another main component that they haven't yet completely given cause and effect, but it's what we do know is that it's very much associated. There's been a couple of gene mutations in our body. They have a big acronym named the MTHFR gene. Methyl tetrahydroxyfolate reductase is a big one. But nonetheless, those genes have been mutating for 4 or 5 decades now. And that gene mutation has caused well, not necessarily cause, but is closely associated with midline related defects. And midline related defects are lip ties, tongue ties, cleft palate, spina bifida. And so a tongue tie is something, it's a connective tissue restriction underneath the tongue that doesn't allow the tongue to function as nature intended. So the tongue then doesn't move as much, which again doesn't develop our jaws and airways as it should. So the westernized diet, as well as the genetic mutations that are associated with midline related defects in tongue ties and lip ties, those two things combined are responsible for what we're seeing in these underdeveloped jaws and airways.
And I'm seeing that, like, this is causing, and I'm just going to name this, all the stuff: snoring, sleep apnea, cognitive health, swallowing disorders, acid reflux, oral disease, allergies. So this can cause allergies too?
Yeah, I mean, from an allergy, there's a very big difference breathing through the mouth versus breathing through the nose. And I'm kind of glad you mentioned allergy, because this takes us really to the hierarchy of our health, breathing, right? Because there's a lot of things that affect our nervous system. But, we were talking about bones and muscles and connective tissue and fascia, but the hierarchy of all of this is, in fact, our nervous system. So when you say allergies, when a person develops orally to the size they should, and then that they develop that big garden hose size airway from our nose to our lungs, that then helps to ensure that they have the adequate size nasal to lungs breathing, right? And if that doesn't occur, if the mouth is underdeveloped, if we don't develop that garden hose size airway, then that nose to lungs breathing is compromised, and we resort to the backup system, which is the mouth. But mouth breathing has major systemic health complications. Number one, if we can breathe through the nose, our nose perfectly cleans the air before it goes in our body. We've got, hairs up in there, which trap a lot of dirt and allergens. We've got these things up in there that look like speed bumps. They're called turbinates. And it slows down the air before it goes in, which allows these paranasal sinuses, where nitric oxide is stored, to filter there. Nitric oxide is virucidal, it's fungicidal. It does so many incredible things in your field. It's a blood glucose regulator. It's involved in protein synthesis. It's a vasodilator so that our oxygen can get into our muscles. But nonetheless, one of our main areas where our nitric oxide is stored is in our paranasal sinuses. So if you have adequate nasal breathing, that nitric oxide is released. It perfectly cleans the air before it goes in the body. But again, you have to have a huge garden hose size airway. If you're breathing through the mouth, none of that occurs. All the allergens that are out there go straight into your lungs. That air is not cleaned for our body, and it becomes very inflammatory. This shows up in asthma. This shows up as allergies. It changes the pH of us, which then changes the cells up in our sinuses, which create mucus. Mouth breathing alone is very detrimental. It changes our entire nervous system. Most people don't realize that, but mouth breathing is sympathetic. Mouth breathing alone activates our sympathetic nervous system, which is very important if you need to be in fight or flight, right? Like if it's a dangerous situation, if you need that adrenaline rush to max out when you're lifting weights, right? But you don't want to be sympathetic nervous system dominant in times of needing parasympathetic, which is rest, digest, relax, and heal. We need to be parasympathetic most of our lives. But if you're mouth breathing, you're in sympathetic.
Wow. So ADHD, gastric diseases, headaches, neck pain, like seriously, all this stuff is caused from mouth breathing, nail biting?
Yeah, ADHD, gosh, that first off, there's no actual test for ADHD. ADHD is diagnosed via symptoms, right? If you have all these symptoms and they give you a drug for the symptom and your body doesn't respond well, then they try another drug. and then perhaps even a third drug. And then if you still don't respond, you must have ADHD.
Mm-hmm.
This was actually one of the very first things that I learned that was my aha moment. They listed the 20 symptoms associated with ADHD, and then they listed the 20 symptoms associated with sleep disordered breathing, and 18 of the 20 are identical. But we're not checking airways in these little kids, right? And you say, well, how does our airway associate with like ADHD? And so if the airway, the nose to lungs passageway, is underdeveloped and we mouth breathe, right? We talked about mouth breathing being sympathetic. So what happens in our sympathetic nervous system? Number one, adrenaline. Yay, when we need it. Number two, inflammation, which is good in small amounts. It starts the healing process. But chronic inflammation is disease, right? Cortisol, all kinds of stuff. Great when we need that fight or flight response, but bad if it's chronic. So our bodies, when those kids are doing that mouth breathing, right, and they're constantly pumping out adrenaline, what happens when they go to sleep at nighttime and they're mouth breathing? Sleep is parasympathetic. It's where our body has a chance to rest and repair itself. That doesn't happen if our adrenaline is constantly producing, right? They're called arousals, actually sleep arousals. So it doesn't necessarily mean it's an apneic episode, but rather than completing 5 to 7 sleep cycles a night, and it's not just a matter of how long we lay there. I was in bed for 8 hours, I was in bed for 9 hours. That's important, but what's even more critical is how many completed sleep cycles we have per night. So 5 to 7 is the goal. And these kids are not completing sleep cycles if they're constantly having that adrenaline shot, that adrenaline arousal. Perhaps, they get to like phase 2 or phase 3, not even phase 3 usually. Phase 2, and that adrenaline kicks in because they're mouth breathing, and then they start right back at square one. Phase 3 of that sleep, like, oh my goodness, that's hormone regulation. It's so critical in these developing kids, critical in adults who need to, who are bodybuilding, right? Hormones. But that occurs typically in our delta wave of our sleep cycle. That's our third wave. But yeah, your mouth breathing, your body's producing adrenaline. You're sympathetic, you're not completing sleep cycles. So your body doesn't have a chance to rest and repair. And then these kids wake up, and my gosh, that adrenaline doesn't magically disappear, right? It's not like you produced it all night long and you wake up and, clean slate. That adrenaline is still around. The little name for it, if you will, is wired but tired. And so how in the world are these kids supposed to sit there and focus all day long when, number one, they didn't rest and repair, and they produced adrenaline all night long? It doesn't happen. So we just, we're slapping labels and prescribing drugs rather than looking at airways.
And why are we doing that?
My lack of knowledge. Most pediatricians have never been taught what oral function has to do with any of this. I worked very closely with the Cleveland Clinic functional medicine department, and actually trained some doctors there on how to recognize underdeveloped jaws, underdeveloped airways, and just to look, to peek in there and see, does this airway perhaps have anything to do with these symptoms of hyperactivity and attention and emotional imbalances? My gosh, you and I as adults know how we feel if one night we don't get a good night's sleep. Maybe your children were awake, or the dog or something, smoke detector battery decided to die. Always dies at 2 o'clock in the morning, right?
Right.
We know how we feel the next day when we don't get one good night's sleep. Imagine a little, right? A 5-year-old, a 6-year-old, 7, and this is their life. This is their every single night. Those emotional imbalances that just occur with it. So, pediatricians are just really not taught it. In the toddler years, a pediatrician is taught, are you gaining weight, and can they eat? And that's really it. And there's so much more to tongue function and jaw development and airway. And yeah.
I mean, you would think something as big as this that could literally solve all these problems, they would teach this in medical school.
Well, think about it. Like, how many years has our Cleveland Clinic been around? I don't know. I really don't. I'm going to say 100. Maybe.
Yeah,
it's
a
long time. But Dr. Mark Hyman founded the Cleveland Clinic Functional Medicine Department, just 8 years ago. So orofacial myology, my portion of it, it utilizes what's called myofunctional therapy. And that is functional medicine, right? And so, yeah, the Cleveland Clinic Center for Functional Medicine has only been around for 8 years. So this is getting back to how our body functions integratively as a whole. So, yeah, most pediatricians really, unless they take it upon themselves to get into functional medicine or start asking why, really have not been taught this at all. I wasn't taught it in my field. In most most dentists, most orthodontists, you think about how many orthodontists are out there, right? And they're putting braces on kids all day long, for the cosmetic aspect of it, right? Most of it is beauty, is cosmetic.
Yeah. I mean, my son just started, oral, and they mentioned nothing about this.
Nothing about this, exactly. So 99% of orthodontists are looking at the crowded teeth as the problem, rather than asking, why do we have crowded teeth? And they are just symptoms of underdeveloped jaws, which are symptoms of underdeveloped airways, which have much, much bigger health implications than just, pretty teeth, if you will.
I mean, it sounds like this has it could solve 90% of the health problems out there. I was just at the Cleveland Clinic visiting a loved one, and it took me 30 minutes to find parking in their 7-story garage. Then when I walked in there, it was like an entire city. I went to bring my loved one a Starbucks. I waited 20 minutes for a Starbucks. I mean, it's packed with people, with sick people.
Yeah. And, orofacial myology is not new. It's, this goes back to, even biblical times, if you will. But this is not new. It's been around forever. It's just slow. We actually don't even have a certifying board here in the United States. My certifying board is international. There's the IOM, International Association of Orofacial Myology. I had to go see.
Yeah, didn't you tell me that you're one of only 437 certified?
Yeah. We might have one or two more within the last couple of weeks.
Great.
Exactly.
440.
With that being said, though, if I had to put a number on it, of the 437 that are certified in the world, the last 200, if you will, have been within the last 5 years. So it is really, really catching on. And even further more than that, last year, of the New York Times bestseller books, we both love reading and educating ourselves, and I'm a forever learner. But last year on the New York Times bestseller was a book named Breath by James Nestor.
I read that book.
Yeah,
great
right?
book.
Good stuff.
Great book.
Right? And I can't wait for his second one to come out, by the way.
Oh, is it?
Yeah,
okay.
I believe he's already done with it. But really, you say, why in the world is a book named Breath? And it really is talking about what we're talking about today. How we breathe determines our entire nervous system. So you're either going through life in an adrenaline-producing chronic inflammation, cortisol, and because of those things, our lymphatic system, our adrenals, our thyroids, our soft squishy glands, right, that help to clean out our body, that methylation process, which is so incredibly important because we're loaded with toxins, right? So we need to clean out that toxic overload. And so we're either going through life in that, or we're going through life parasympathetic, which is rest, digest, relax, and heal. It's coming around. It's coming around. There were books out there. There's been oodles. A lot of my colleagues have written books in the last 2 years, of which are for all ages, whether it be a baby that has oral dysfunction where they can't flange their lips to make a seal around the breast, to properly pull the milk out and feed, to children with speech and language pathology, right? To adults that have TMJ, clenching, grinding of the teeth, on into upper airway resistance syndrome and sleep apnea. All of those things, crowded teeth, crooked teeth, all of those things are byproducts of oral dysfunction.
Wow. It's good stuff. So let's talk about now the actual therapy on what you do and how to improve the airway and the jaws and the tongues and all that.
So yeah, first, my specialty is really just in ages, say 4 and older. I utilize what's called myofunctional therapy, and that is an exercise-based program to develop the jaws, to have good tongue rest posture, which supports our lower jaw, which is a free-flowing bone, and then directs that fascia and muscles all the way down to our toes, so good skeletal alignment. So I utilize myofunctional therapy. So really ages 4 and up, because they need to take instruction and follow through. You train, and the person needs to take instruction and follow through. Same with me. So that's my field. And so first we need to do a comprehensive assessment. Every person had their function, their dysfunction is unique to them. And so I want to see what muscles are working good, which ones aren't, which ones are working overtime to make up for the ones that aren't. I want to quantify. So I'm going to measure, and I'm going to look at that oral rest posture. I'm going to look at that swallow. We use anywhere from 20 to 32 muscles every single time we swallow, 1,500 times a day. I'm going to look at if that oral function matches skeletal posture and alignment. If I can see that perhaps maybe one side of the tongue is a little tighter, is a little weaker, and is not elevating during that swallow, it then asks a bigger muscle to help, like our masseter, which asks a sternocleidomastoid masseter, which asks a trapezius, which asks for quadrilumbar. And I'm going to see that foot on that same side pronated. So I'm going to see if our top matches our bottom. So I'm going to do a full comprehensive assessment on them, and then I'm going to ask them what their goals are. What are their systemic health issues? What are their goals? And I'm going to create a muscle-based exercise program to either develop them if they're in their adolescent years, or correct them in their adult years.
Wow. So, yeah, that's a highly comprehensive, assessment that you're doing. And how long are your patients then in this program?
Again, every person is different, because if I'm working with an adolescent, not all muscles integrate developmentally at the same time. We can see that perhaps like in our adolescent speech, right? They can say like, I love you instead of like, I love you, right? So not all muscles integrate at a specific age. And so I'm going to work with what's developmentally appropriate. Adults, anyone after say age, not even adults, age like 7 or 8, all muscle integration occurs developmentally at that time. So I'm going to see somebody maybe once every 2 to 3 weeks, and then we need to let it integrate at home. And then I'll see them back. Sometimes their therapy is phased. Sometimes I need the help of an airway-centric orthodontist. And what do I mean by that? Our palate, the roof of our mouth, is about 93% mature by age 10, and about 100% mature age by 11. And the roof of our mouth is the floor of our nose, which is the start of that airway we were talking about. The roof of our mouth determines the size of our maxillary sinuses right here. So we need them to be fully developed so that they can drain properly. Obviously, if they're underdeveloped and mucus forms in there and it doesn't drain properly, we can't stop you, right? And then we have to open our mouth to breathe, and we've already talked about that. But nonetheless, if I have a child that's say like 8.5 years old, and that palate is severely underdeveloped, and I know that window of growth is closing on us, I'd love to be able to just restore tongue function and let the muscles of the tongue grow. I firmly believe in the body fixing the body, right? But I know that window of growth is closing on us, or I can't really get that tongue to make up for that underdevelopment in the time I need. So I'm gonna do the myofunctional therapy, and we're gonna utilize a few sessions of that, and then I'm gonna send them over to an airway-centric orthodontist, which is very different from just traditional braces, right? And I might have the airway-centric orthodontist put in a palatal expander, and uses a little key, and might do a little turn every single day.
That's what Nathan had.
Fantastic, right? And my gosh, we can get like 7-8 millimeters in 3 weeks. Yeah. And you say that, a millimeter is a pretty small measurement, but 1 millimeter of transverse growth, so 1 millimeter of width, is 2.4% of our airway. So my gosh, if I can, utilize a hollow expander and get 7-8 millimeters in 3 weeks, we're talking about like a 20-25% increase in the nasal passages in the airway. And if we can breathe through the nose, then I can get these lips closed. And then we're talking about systemic health changes in 3 weeks simply by utilizing an airway-centric dentist. So some of their therapy might be phased, right? Phased until we've reached the level of development and muscle restoration and balance and integrative health that the patient desires.
Amazing. Yeah, I think Nathan is a mouth breather. So
most of our kids are.
Most of the kids are, again, because of what the parents ate.
Either that genetic mutation that caused tongue tie, right? That caused a tongue tie that didn't allow the tongue to function. That would be a cause, and or the diet that these children are given, right? Like, think about it. 50 years ago, 75 years ago, we didn't have Gerber stages 1, 2, 3, and 4, right? The parade baby food. We didn't have pouches. We had what was called baby-led weaning, right? That child was handed a lamb bone, if you will, was handed a whole carrot out of the ground in the chew and the chew and the chew and the chew. And then somewhere we thought it was cute to develop Gerber stages 1, 2, 3, and 4, these parades. If you look at the Gerber baby, the mouth is open.
Wow.
The mouth is open of the coveted, beautiful Gerber baby. And that was like the symbol, if you will, of a healthy, cute, chubby little baby, right? The mouth is open.
Wow, we just got it all wrong, don't we?
We got it all wrong. We got too far off the path. Yeah.
And now we're just labeling kids with ADHD and prescribing them pills, and that's not even why. They're not even that's not even what they have. It's their mouth breathers.
It may be, but much of it, and grinding of the teeth, right? That was probably the second aha moment, if you will, when I was learning of this was, grinding of the teeth, like adults grind their teeth. And there's a lot of reasons why. The number one is that the tongue actually is not providing jaw stability. So we then have to activate other muscles to make up for that, which brings our teeth together. But in children, this is different. Study after study after study shows that if a child is grinding their teeth, it has nothing to do with stress. Zero. It is almost always because by sliding the lower jaw forward, it's artificially opening up the depth of the airway, right? When we talk about airway, you and I have covered a lot of the width of that airway, right? But what about the height and what about the depth? The height is the vertical dimension of the way back in our throat. If our swallow is affected, then that area opens up vertically. It's like, hey, open up, something's coming down the pipe, right? We got to make room for whatever it is we're swallowing. And then what about the depth of that airway? We talk about that garden hose size airway. All three dimensions are equally important. So in a child, the grinding of the teeth is major red flag that they are trying to slide that lower jaw forward when they're on their backs to open up the depth of that airway.
So what advice would you give someone who's listening that is a mouth breather?
What advice would I give them? Find a orofacial myologist. There's
only 437 of them. Are they all coming to you?
Well, you know what? No, they're find an orofacial myologist. Find an airway-centric dentist. Those are becoming. A lot of dentists are recognizing that what they've been taught. There's got to be a bigger piece to the puzzle, right? Like, a regular dentist goes in and fixes a molar, if you've broken a tooth, right? They put a beautiful composite in it, they put a crown in it, and then, my goodness, that person destroys the filling, he breaks the crown or that. Like, what's going on here? So, or they put, gorgeous cosmetics on the teeth and then they're worn down or they're chicken regular. Like, what's going on here, right? So a lot of dentists, through their own actual frustrations of their work not lasting long, it's like asking the questions, the why, the what's going on here, and so they're recognizing airway related problems. So airway centric dentist, orofacial myologist, even though dental hygienist may not be an orofacial myologist, they're learning about myofunctional therapy. That is where I started.
Are they teaching it now in dental school? Or
I don't know if they're teaching it yet. But a lot of there's a lot of people that are starting to learn out there. So really, in children, this would be recognized as a baby that can't nurse very well, right? Maybe they have colic, right? And they're spitting up a lot, and then the pediatrician prescribes them, Pepcid or whatever. Ask why. There's a reason like that. If those lips can't flange, if they can't make a seal, if that tongue isn't pulling out that milk, then they're taking in air, right? In that air creates a positive pressure down here and a negative up here, and it's coming back up, right? So colic. So if you have issues with feeding, if a child has immature speech, right? We think it's cute when they say "I love you" instead of "I love you," but the difference is lack of tongue elevation, right? So if you're seeing a toddler that has immature speech, ask why. If you're seeing a child, a kindergartner, a first grader, a second grader that hasn't lost any baby teeth yet, right? What's going on here? Why is everyone else, my kids' friends are losing their teeth, but my kid is not? Why, right? That means that there's not enough development in there for those adult teeth, to push out the baby teeth. It's really just kind of asking why. There's some great books out there we talked about, reading about this, but you can find an airway-centric dentist.
So it sounds like your message is to just be curious and ask why. Don't just take things for whatever the doctor, dentist, or whoever you're seeing tells you. Like, dive deeper, ask why, do some research.
That's right. And it's not just this field. In our medical world, to no fault of their own, they're just really not taught any of this stuff, right? They're not taught the integrative part of it, the functional medicine part of it. Much of our healthcare is allopathic. We're treating the downstream symptoms associated with lack of natural body function, lack of natural body integration.
It's like our medical industry is at its infancy stage.
Or the easy button.
Or the easy button, but who's it easy for?
Them.
Yeah. But it sucks for everyone else.
It does, right? Because, as we're treating the symptoms associated with things and not getting to the organic root cause, what they're prescribing, which is usually pharmaceutical, right, has side effects as well. So then something else is a health issue because of the side effects of how we're treating things rather than looking at us functionally and integratively and developmentally. And, we were created perfectly. We were perfectly created. We've just gotten
sidetracked, right?
Yeah.
We kind of think that we had the power to take things in our own hands, and that's just not how it is, right?
That's not at all how it
Even
is.
like you and I talked about meat, like I don't eat meat anymore because of what the meat eats, what the animal eats.
Yeah.
And that's, you mentioned that's not necessarily good either because of the chewing, the lack of chewing, right?
That's right. Our meat has gotten a bad rap, but rightfully so. If you think about it, how our animals are raised and what they're fed and the conditions that they're under, in most cases is incredibly toxic, right? They're in stressful situations. They're fed genetically modified grains. Our cows are given hormones to produce milk. They're actually given, last I read, was 9 times the amount of hormones that they would naturally produce. And those hormones are then coming through the meat in the milk and the cheese and stuff and showing up in our bodies, right? So rightfully so, most meat is toxic. But the problem is, so if you resort to just a vegan diet or vegetarian diet, well, again, that's lack of mastication, right? That's lack of chewing. So that's underdeveloped jaws and underdeveloped airways. And lack of vagal tone, actually. We didn't really get into that much. But, that the hierarchy of our health being our nervous system, and we need to be very parasympathetic dominant, requires a really, really healthy vagus nerve. Our vagus nerve is one of our 12 cranial nerves, and it operates our entire parasympathetic nervous system. So those rest, digest, relax, and heal. So you really need a very toned, a very healthy vagus nerve. And when the swallow is effective, meaning good range of motion, and occurs 1,500 times a day, it opens our throat way back there, our soft palate. It opens it vertically. In that soft palate back there, that arch back there, you can kind of see the floppy little uvula back there, right? That's the arch we're talking about. So when you swallow effectively, that arch elevates. And so that arch is the very first part of our body that our vagus nerve enters when it leaves our brainstem. So if that arch elevates as it should through a really healthy swallow, then that vagus nerve is naturally, functionally, organically being toned 1,500 times a day. And that vagus nerve is the operational system, is the energy behind the function of your rest, of your digest, of your relax and heal. So you want to be sure that you are in fact masticating and chewing and having a good swallow, and that doesn't occur in our softer diets. And so, what do we do, right? What do we do?
What do I do? What does someone like me do?
And so you make sure that rather than eliminating, entire food.
By the way, does chewing gum count?
No.
Okay.
Nice try. But what do you do? You don't look at what you're eating. You look at what you eats. You look at the environment of what you're eating is, right? And so making sure that your meat is grass-fed, is grass finished, that animal is out soaking up all the vitamin D and feeding off of the grass that doesn't have glyphosate sprayed on it, and the bugs, the natural bugs, is not given hormones. So there are farms out there. A lot of them actually are local. I have a couple favorites.
Really?
That's exactly how their animals are raised. They are grass-fed and finished. So you're not getting, all the garbage. You're getting clean meats for muscle building and protein synthesis. In that meat has wonderful oxygenation in it for us.
So grass-fed and finished. Because sometimes you go to the grocery store and it just says grass-fed.
That's right. And that's,
not the same.
Not the same. Without getting, there, you can say grass-fed if, you're throwing a handful of grass.
Right at the end, right?
Yeah, exactly. So and we need more regulation on that. We need more specifics, more control with our adequate labeling. But grass-fed and finished adequately means that the animal is in fact primarily out in the pastures with the sun and the healthy nutrients, and without glyphosate and hormones and that kind of stuff. So making sure what you eat has a healthy lifestyle, because if it doesn't, you're putting all of that into it.
And that's why I went vegan. But now I don't know. Now it's got me thinking, because obviously the plant protein substitutes I'm taking aren't great for chewing. There's no chewing, even though I do mix them in with some nuts and stuff.
Right. Yeah. In it's not even, we talked about the chewing and the vagus nerve and the jaw development and the airway development and stuff like that. But even the movement of the tongue provides neurotransmitters to our prefrontal cortex, to our amygdala. They did studies when the tongue hasn't even formed yet. The tongue is literally in the tooth bud, stages, if you will. This is like when a woman finds out she's pregnant for the first time, 6 weeks in utero, 8 weeks in utero. Those tongue tooth buds are vibrating before the tongue is even formed. In the direct neurotransmitters that are emitted to our brain is incredible. Our tongue is literally an energetic highway, not just neurotransmitters, but we have 12 cranial nerves in our brain. 12 cranial nerves. They operate our entire body, motor, sensory, and both, right? So they are the energy behind our function, these 12 cranial nerves. And in the oral area, way back behind the tongue, 5 of our 12 cranial nerves intersect in that area. It is an energetic highway. needs movement, it needs tone for whole body health.
Wow. Okay, so be curious. Don't just take what the doctors give you, but be curious if you suffer from any of this stuff: snoring, sleep apnea, ADHD, cognitive health, swallowing disorders, allergies. I mean, that's crazy. You know how many people out there take allergy pills because they're just like, oh, it's allergy season.
Skeletal misalignment, right? If the tongue is restricted in its function, if the tongue is tight, right? Not growing the jaws in areas. If the tongue is tight, then this whole area right here, because our tongue is actually connected to our hyoid bone, fancy muscle, hyoglossus.
I gotta repeat that.
You told me not to quiz you, but I'm quizzing
maybe
on
part two.
Right, part two. But our tongue is connected to this area. So if our tongue is restricted in its function, this area is very, very tight. We have forward head posture. And where our head goes is where our pelvis and our sacrum go. I like to talk about it like the alignment of the car, right? Like a front wheel drive car. This isn't my field, so you know.
You're not a mechanic either.
For the body, yes. For cars, no. But nonetheless, wherever the head goes is where the pelvis and sacrum goes. So that if our head comes forward because this area is tight, then our pelvis and our sacrum rotate forward, right? And then we're literally crushing our diaphragm, which our diaphragm is our skeletal stabilizer, only part of our body that connects the front to the back. So skeletal misalignment.
Lower back pain, right neck pain.
That's right. Are we looking at oral posture? Are we looking at tongues?
Okay, there's a lot here, but I mean, there's good news if you do suffer from any of this, or if you know anybody, or So how could someone reach you or find out more information?
Me or anybody in my field.
Let's talk about.
Let's talk about anybody.
Yeah, anybody.
Anybody. How do you find? So Orofacial Myologist, COM, certified Orofacial Myologist. The best is probably to go to the website. So it IAOM.com. Go to their website and there's a directory. You literally can put in your zip code, and anybody that's a COM is going to pop up, in your area. And if you can't find a COM, a good place to start would be somebody that is trained in myofunctional therapy. And that's kind of the start of this. Their website would be aomt.org. So I think it's info@aomt.org. Let me get back to you on that one.
Okay.
But
we'll put it in the comments.
that was the website that I used many years ago. But again, directory. So lots and lots of dental hygienists, lots of speech and language pathologists, airway centric dentists are at least trained in myofunctional therapy or starting, and so you can find somebody in that area, find an airway centric dentist. Read the breath book.
Definitely, that's a great book. Can't wait for the second one. Okay.
Yeah.
Fantastic. Tamara Higgs, thank you so much. This was an amazing podcast. We missed Eric, but we really didn't. Thank you guys for listening, and feel free to reach out if you have any questions, comments, or anything. Thanks, guys.
Thank you.